Hello, my name is Liliana Aracely Romero Molina. I study medicine. Today I will read an article. A new doctor tested a new treatment on himself. Now it may help others with this rare disease. A doctor's quest to understand his own rare disease led him to test an experimental treatment on himself. A doctor's quest to understand his own rare disease led him to test an experimental treatment on himself, and it may have worked. The physician, Dr. David Fajgenbaum, an assistant professor at the University of Pennsylvania Spelman School of Medicine, has been in remission ever since he first used himself as a test subject 5 years ago. Now a new study suggests Fajgenbaum's treatment may help others with this rare inflammatory disorder known as Castleman disease. The new research shows the patients with severe forms of the condition who haven't responded to previous therapies may benefit from a treatment that targets a specific signaling pathway inside cells called the PL3KAKTMTOR pathway. They were published today, August 13, in the Journal of Clinical Investigation. Is one of the few occasions when the lead author of the report, Fajgenbaum, is also a patient in the study. The doctor's quest began in 2010 when Fajgenbaum, who was then athletic 25 years old in medical school, suddenly fell ill. He developed swollen lymph nodes, abdominal pain, fatigue, and an eruption of small red spots on his body. According to the report, Fajgenbaum's condition soon worsened and became life-threatening. Fajgenbaum was eventually diagnosed with Castleman disease, which is actually a group of inflammatory disorders that affect the lymph nodes. About 5,000 people in the U.S. are diagnosed with some form of Castleman disease each year. Patients with Castleman disease may have a mild form of the disease with a single affected lymph node, while others have abnormal lymph nodes throughout their body and develop life-threatening symptoms, including organ failure. Fajgenbaum has its more severe form, known as idiopathic multicentric Castleman disease (IMCD), which is diagnosed in only about 1,500 to 1,800 Americans each year, according to the report. This severe form of the disease is similar to several autoimmune conditions, but like cancer, it also causes an overgrowth of cells, in this case in the lymph nodes. About 35% of people with an NCD die within 5 years of the diagnosis, although this is one approved treatment for Castleman disease, a drug called cetuximab. Not all patients respond to the therapy. Fajgenbaum fell into this group. No existing therapies helped him, and his symptoms kept coming back during the 3.5 years after his diagnosis. He was hospitalized 8 times, the report said, but by studying his own blood sample, Fajgenbaum identified a possible clue to his illness. Right before a flare-up, he saw a spike in the number of immune cells called activated T cells, as well as increase in levels of a protein called VEGFA. Both of the factors are regulated by the PL3KAKTMTOR pathway. Fajgenbaum hypothesized that a drug that inhibited this pathway might help with this condition. He turned to a drug called sirolimus, which inhibits this pathway and is already used to prevent organ rejection in kidney transplant patients. Fajgenbaum has had flare-ups of symptoms since he started taking the drug in 2014. In the new study, Vagabond and College report that two other patients with IMCD had showed increased levels of activity T cells and VEGFI before the symptoms flare up after treatment with sirolimus. Both patients also showed sustained remission. So far, both patients have gone 19 months without a relapse. Our findings are the first to link T cells PEGFA and the PL3KAKTMTOR pathway to IMCD, Fagenbaum said in the assessment. Most importantly, test patient improved when inhibited mTOR. This is crucial because it gives us a therapy target for patients who don't respond to siltuximab. Although the new findings are promising, the study involved only 3 patients, and larger trial will be needed to show that this drug is an effective treatment for IMCD. So Fagenbaum and colleagues plan to start a clinical trial to test sirolimus in up to 24 patients with IMCD. Thank you.